Welcome, everyone, to From Dirt We Grow. I'm your host, Stephanie Kendall. Thank you so much for joining me today as we talk about yet another broken and misguided system that we're forced to be subjected to. But before we get into it, I want to remind you to please hit me with the LSB, like, subscribe, and bell, and do not forget to share the message because nowadays it is so important to get the word out about these crucial issues. And on to this issue of healthcare in the United States. It is a complex mix of public and private insurance with no single universal system. It's kind of a mess, actually. It is definitely designed for profit, not for the people. And too many people are left without or with inadequate coverage due to expensive insurance plans, high premiums, and the cost of prescriptions and the abundance of prescriptions, the medications that are prescribed these days, thanks to the healthcare network's partnerships with the pharmaceutical companies. Do you know the average American takes 4 prescription medications daily, most of which we don't even need? In so many cases, patients come in to the healthcare buildings seeking just basic or even advice about simple home remedy treatable ailments, and they are prescribed drugs rather than simply being told to explore simple remedies like lifestyle changes, physical therapy, or diet adjustments. More often than not, hospitals receive financial incentives or rebates for prescribing certain drugs from pharmaceutical companies, and their reps aggressively market medications directly to doctors, influencing their treatment plans. The truth is, hospitals and pharmaceutical companies profit more from managing symptoms rather than actually treating the root cause. They want to keep you coming back. If they fix your problem, they lose out on your return business. You need to keep coming back because your ailment is just managed, not fixed, not cured. So by placing you on multiple medications, you keep coming back for refills. By citing your status as manageable, you keep coming back for follow-up appointments and these bill-racking procedures and tests, making you dependent on them so they can keep their hands in your pockets. This is also a big reason why the research efforts for many possibly curable diseases by now, namely cancer for one, are charity based, not funded by the multi-trillion-dollar healthcare industry. Because think about it, if they cure cancer, imagine all the clientele they lose, all the money they miss out on. This deplorable display of blatant hand over fist exploitation of the American people is yet another solid indication of the government failing to give a fuck about championing for the people. According to facts.org, facs.org, now listen to this. In the US, compared to similar Western countries, has the lowest life expectancy at birth, the highest maternal and infant mortality rate, the highest hospitalization rate from preventable causes, the highest death rate for avoidable and treatable causes, and the highest chronic disease burden rate in the world. These are stats from the best country on earth. How can we even make such a claim without choking on the words? It's ridiculous. Every government backed or overseen system of operation in place in the US today is ingrained in this scheme to keep money flowing to the rich and powerful to the detriment of the average and below citizen. And the insurance companies are no better. They've got their hands out. The top 6 healthcare insurance companies profited over $41 billion in 2022 alone, as told to us by Forbes.com. While nearly 1 in 3 Americans are plagued with overwhelming medical debt. You guys, every facet of our lives, every human necessity has a price tag on it through insurance or taxes or credit score. I don't know about you, but the only question this position they've placed us in has me asking, am I bent over far enough for you yet? Healthcare should not be optional. It should not be exploited, and it should not be left to the whims of the greed seekers asking, what's in it for me if I help you? It is a basic human right. It should be a given that all people have access to trustworthy, unbiased, no strings attached, life sustaining care. A complete reform is needed, and every single person that has been in the position to do it has failed us. So it is, again, up to us. The American healthcare industry needs to be drastically modified to actually support the needs of the people, not the greeds of the companies, which honestly can only be a possibility if we, the people, come together despite our differences, our superficial, surface level differences, perpetuated by design of those in power, and stand up for ourselves, not for our individual selves, but as a whole, to say we deserve better. We can do better. There is a better way. We demand better from our leaders, those appointed to their positions for the purpose of providing us better. It's time to rise above fighting each other and fight the system tearing us apart. We are greater in numbers, greater in strength, and greater in solidarity. You guys, share this, like this, support this. I need you. We need each other. I'm Stephanie Kendall. This is From Dirt We Grow. Thank you for listening.